On December 26, 2004, an earthquake measuring 9.2 hit the west coast of northern Sumatra, generating a tsunami with waves up to 100 feet. What we are seeing is one of the deadliest disasters in modern history. Indonesia and Sri Lanka are among the areas hardest hit. Thousands have been displaced. Anywhere from 228,000 to 310,000 people are thought to have died, but the count is not yet complete. Quick to join the international relief effort, Kaiser Permanente identifies Dr. Brian D. Hertz as the Disaster Relief Project Director, who selects and organizes teams of physicians to help in the health camps in Sri Lanka and the mosquito abatement programs in Banda Aceh, Indonesia. Of the initial 7 Permanente physicians participating in the relief effort, Doctors Hernando Garzon, Catherine McNally, and David Witt had not yet returned in time for our taping. We caught up with the 4 physicians who recently returned, eager to share the experiences and photos of their journey.
I'm originally from Sri Lanka, and I came to the States as a 17-year-old. And when I first saw this massive disaster, my first inclination as a human being, as a doctor, somebody who could be of immense help, I have to go. We just jumped right into the relief camps, started taking care of patients right in the middle of the heart of it all to be able to help people and essentially taking care of their medical needs, emotional needs, psychological needs. I've really learned from this experience is how meaningful is this profession of medicine, to be able to be a medical care provider, a doctor, to touch people's hearts and to heal people's lives.
Almost everybody who saw the pictures of the tsunami and saw the faces of the children and the devastation, our hearts went out to them, and everybody I know wanted to help. My children are Tamil. Their father is from Sri Lanka. And so when I looked at the pictures of the children, I saw my own children's faces. I felt very fortunate to be there because 50% of the people who needed to be seen were the children. And they had dysentery, they had pneumonias, a lot of upper respiratory tract infections. So the things that we expected to see.
I sent an email to say that I am from Sri Lanka and I speak the language and I have a lot of contacts and I would like to go. We would set up our clinic there and then would see patients. We took blood pressures for the pregnant mothers, and then anyone who was sick was asked to come. They would line up.
We were greeted very warmly by the people and also very warmly by the hospital administration. I think because Christine was able to bridge the cultural gap, so we came in almost as a Sri Lankan team, but with American resources and American personnel.
They wanted to talk. They just wanted to talk, just pour their hearts out. I speak both Sinhalese and Tamil, so that made it easy for me to be the interpreter for everyone and also be the person to listen to the people so that they were able to communicate. I'm so proud to be a physician of the Kaiser Permanente.
The goal and the mission was basically to do public health and malaria control. So we were working with non-governmental organization and NGO called Mentor Initiative, which is primarily sponsored by the British government to prevent and diagnose, control malaria. 20% of the hospital staff after the tsunami survived and returned to duty, so a significant portion of the knowledge and know-how was missing. And a lot of what we did and attempted to do was replace temporarily, but also get new infrastructure in place. I had the opportunity to work with the Minister of Health for malaria who came in from Jakarta, and he brought in 12 people from Java who basically substituted for the missing people in the different districts that were hardest hit. And so we did training sessions for those people and then dispersed both the rapid diagnostic tests and the medicines to all the districts that were hit. It's given me a different perspective and just an incredible thankfulness about my family and about the work environment at Kaiser that I have.
The plan is to continue providing clinical support, rotating Permanente physician teams throughout these identified areas. An overwhelming volume of people responded to Dr. Robert Pearl's initial call, and this generous spirit continues to grow.
Not only are we able to deliver good health care, but we're definitely ambassadors of goodwill from America and from Kaiser Permanente.
Being human, this is what we are supposed to do, to take care of people and to respond to a disaster like this and to extend a helping hand across the oceans. We are just doing what we are meant to do.